Section 36 of Gray's Anatomy. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Anterior Divisions, Part 1. 6b. The Anterior Divisions. Rami anteriores. The anterior divisions of the spinal nerves supply the anterolateral parts of the trunk and the limbs. They are for the most part larger than the posterior divisions. In the thoracic region they run independently of one another, but in the cervical, lumbar, and sacral regions they unite near their origins to form plexuses. The cervical nerves. Nervus cervicalis. The anterior divisions of the cervical nerves, rami anteriores, with the exception of the first, pass outward between the intertransversarii anterior and posterior, lying on the grooved upper surfaces of the transverse processes of the vertebrae. The anterior division of the first, or suboccipital nerve, issues from the vertebral canal above the posterior arch of the atlas, and runs forward round the lateral aspect of its superior articular process, medial to the vertebral artery. In most cases it descends medial to and in front of the rectus capitis lateralis, but occasionally it pierces the muscle. The anterior divisions of the upper four cervical nerves unite to form the cervical plexus, and each receives a grey ramus communicans from the superior cervical ganglion of the sympathetic trunk. Those of the lower four cervical, together with the greater part of the first thoracic, form the brachial plexus. They each receive a grey ramus communicans, those for the fifth and sixth being derived from the middle, and those for the seventh and eighth from the lowest cervical ganglion of the sympathetic trunk. The cervical plexus. Plexus cervicalis. The cervical plexus is formed by the anterior divisions of the upper four cervical nerves. Each nerve, except the first, divides into an upper and a lower branch, and the branches unite to form three loops. The plexus is situated opposite the upper four cervical vertebrae, in front of the levator scapulae and scalenus medius, and covered by the sternocleidomastoideus. Its branches are divided into two groups, superficial and deep, and are here given in tabular form. The figures following the names indicate the nerves from which the different branches take origin. Superficial. Smaller occipital, 2c. Greater auricular, 2-3c. Cutaneous cervical, 2-3c. Supraclavicular, 3-4c. Deep. Internal, communicating, with hypoglossal, 1-2c, with vagus, 1-2c, with sympathetic, 1-2-3-4c. Muscular. Rectus capitis lateralis, 1c. Rectus capitis anterior, 1-2c. Longus capitis, 1-2-3c. Communicantes cervicalis, 2-3c. Phrenic, 3-4-5c. Communicating with accessory, 2-3-4c. External, muscular. Sternocleidomastoideus, 2c. Trapezius, 3-4c. Levator scapulae, 3-4c. Scalenus medius, 3-4c. Superficial branches of the cervical plexus. The smaller occipital nerve, Nervus occipitalis minor, small occipital nerve, arises from the second cervical nerve, sometimes also from the third. It curves around and ascends along the posterior border of the sternocleidomastoideus. Near the cranium it perforates the deep fascia, and is continued upward along the side of the head behind the auricular, supplying the skin and communicating with the greater occipital, the greater auricular, and posterior auricular branch of the facial. The smaller occipital varies in size, and is sometimes duplicated. It gives off an auricular branch, which supplies the skin of the upper and back part of the auricular, communicating with the mastoid branch of the great auricular. This branch is occasionally derived from the greater occipital nerve. The great auricular nerve, Nervus auricularis magnus, is the largest of the ascending branches. It arises from the second and third cervical nerves, winds around the posterior border of the sternocleidomastoideus, and, after perforating the deep fascia, ascends upon that muscle beneath the platysma to the parotid gland, where it divides into an anterior and a posterior branch. The anterior branch, ramus anterior, facial branch, is distributed to the skin of the face over the parotid gland, and communicates in the substance of the gland with the facial nerve. The posterior branch, ramus posterior, mastoid branch, supplies the skin over the mastoid process and on the back of the auricula, except at its upper part. A filament pierces the auricula to reach its lateral surface, where it is distributed to the lobule and lower part of the concha. The posterior branch communicates with the smaller occipital, the auricular branch of the vagus, and the posterior auricular branch of the facial. The cutaneous cervical, nervus cutaneous colli, superficial or transverse cervical nerve, arises from the second and third cervical nerves, turns around the posterior border of the sternocleidomastoideus about its middle, and, passing obliquely forward beneath the external jugular vein to the anterior border of the muscle, it perforates the deep cervical fascia, and divides beneath the platysma into ascending and descending branches, which are distributed to the anterolateral parts of the neck. The ascending branches, rami superiores, pass upward to the submaxillary region, and form a plexus with the cervical branch of the facial nerve beneath the platysma. Others pierce that muscle, and are distributed to the skin of the upper and front part of the neck. The descending branches, rami inferiores, pierce the platysma, and are distributed to the skin of the side and front of the neck, as low as the sternum. The supraclavicular nerves, nervus supraclaviculares, descending branches, arise from the third and fourth cervical nerves. They emerge beneath the posterior border of the sternocleidomastoideus, and descend in the posterior triangle of the neck beneath the platysma and deep cervical fascia. Near the clavicle they perforate the fascia and platysma to become cutaneous, and are arranged, according to their position, into three groups: anterior, middle, and posterior. The anterior supraclavicular nerves, nervus supraclaviculares anteriores, suprasternal nerves, cross obliquely over the external jugular vein and the clavicular and sternal heads of the sternocleidomastoideus, and supply the skin as far as the middle line. They furnish one or two filaments to the sternoclavicular joint. The middle supraclavicular nerves, nervus supraclaviculares medii, supraclavicular nerves, cross the clavicle and supply the skin over the pectoralis major and deltoideus, communicating with the cutaneous branches of the upper intercostal nerves. The posterior supraclavicular nerves, nervus supraclaviculares posteriores, supraacromial nerves, pass obliquely across the outer surface of the trapezius and the acromion, and supply the skin of the upper and posterior parts of the shoulder. Deep branches of the cervical plexus, internal series. The communicating branches consist of several filaments, which pass from the loop between the first and second cervical nerves to the vagus, hypoglossal, and sympathetic. The branch to the hypoglossal ultimately leaves that nerve as a series of branches, viz., the descending ramus, the nerve to the thyreohyoideus, and the nerve to the geniohyoideus. A communicating branch also passes from the fourth to fifth cervical, while each of the first four cervical nerves receives a grey ramus communicans from the superior cervical ganglion of the sympathetic. Muscular branches supply the longus capitis, rectus capitis anterior, and rectus capitis lateralis. The communicantes cervicalis, communicantes hypoglossae, consist usually of two filaments, one derived from the second and the other from the third cervical. These filaments join to form the descendens cervicalis, which passes downward on the lateral side of the internal jugular vein, crosses in front of the vein a little below the middle of the neck, and forms a loop, ansa hypoglossae, with the descending ramus of the hypoglossal in front of the sheath of the carotid vessels. Occasionally the loop is formed within the sheath. The phrenic nerve, nervus phrenicus, internal respiratory nerve of Bell, contains motor and sensory fibres in the proportion of about 2 to 1. It arises chiefly from the fourth cervical nerve, but receives a branch from the third and another from the fifth. The fibres from the fifth occasionally come through the nerve to the subclavius. It descends to the root of the neck, running obliquely across the front of the scalenus anterior, and beneath the sternocleidomastoideus, the inferior belly of the omohyoideus, and the transverse cervical and transverse scapular vessels. It next passes in front of the first part of the subclavian artery, between it and the subclavian vein, and, as it enters the thorax, crosses the internal mammary artery near its origin. Within the thorax it descends nearly vertically in front of the root of the lung, and then between the pericardium and the mediastinal pleura to the diaphragm, where it divides into branches, which pierce that muscle, and are distributed to its under surface. In the thorax it is accompanied by the pericardiacophrenic branch of the internal mammary artery. The two phrenic nerves differ in their length, and also in their relations at the upper part of the thorax. The right nerve is situated more deeply, and is shorter and more vertical in direction than the left. It lies lateral to the right innominate vein and superior vena cava. The left nerve is rather longer than the right, from the inclination of the heart to the left side, and from the diaphragm being lower on this than on the right side. At the root of the neck it is crossed by the thoracic duct. In the superior mediastinal cavity it lies between the left common carotid and left subclavian arteries, and crosses superficial to the vagus on the left side of the arch of the aorta. Each nerve supplies filaments to the pericardium and pleura, and at the root of the neck is joined by a filament from the sympathetic, and occasionally by one from the ansa hypoglossae. Branches have been described as passing to the peritoneum. From the right nerve, one or two filaments pass to join in a small phrenic ganglion with phrenic branches of the celiac plexus, and branches from this ganglion are distributed to the falciform and coronary ligaments of the liver, the suprarenal gland, inferior vena cava, and right atrium. From the left nerve, filaments pass to join the phrenic branches of the celiac plexus, but without any ganglionic enlargement, and a twig is distributed to the left suprarenal gland. Deep branches of the cervical plexus, external series. Communicating branches. The external series of deep branches of the cervical plexus communicates with the accessory nerve, in the substance of the sternocleidomastoideus, in the posterior triangle, and beneath the trapezius. Muscular branches are distributed to the sternocleidomastoideus, trapezius, levator scalpuli, and scalenus medius. The branch for the sternocleidomastoideus is derived from the second cervical. The trapezius and levator scapulae receive branches from the third and fourth. The scalenus medius receive twigs either from the third or fourth, or occasionally from both. The brachial plexus, plexus brachialis. The brachial plexus is formed by the union of the anterior divisions of the lower four cervical nerves and the greater part of the anterior division of the first thoracic nerve. The fourth cervical usually gives a branch to the fifth cervical, and the first thoracic frequently receives one from the second thoracic. The plexus extends from the lower part of the side of the neck to the axilla. The nerves which form it are nearly equal in size, but their mode of communication is subject to some variation. The following is, however, the most constant arrangement. The fifth and sixth cervical unite soon after their exit from the intervertebral foramina to form a trunk. The eighth cervical and first thoracic also unite to form one trunk, while the seventh cervical runs out alone. Three trunks, upper, middle, and lower, are thus formed, and, as they pass beneath the clavicle, each splits into an anterior and a posterior division. Footnote: the posterior division of the lower trunk is very much smaller than the others, and is frequently derived entirely from the eighth cervical nerve. End of footnote. The anterior divisions of the upper and middle trunks unite to form a cord, which is situated on the lateral side of the second part of the axillary artery, and is called the lateral cord, or fasciculus of the plexus. The anterior division of the lower trunk passes down on the medial side of the axillary artery, and forms the medial cord or fasciculus of the brachial plexus. The posterior divisions of all three trunks unite to form the posterior cord or fasciculus of the plexus, which is situated behind the second portion of the axillary artery. Relations. In the neck, the brachial plexus lies in the posterior triangle, being covered by the skin, platysma, and deep fascia. It is crossed by the supraclavicular nerves, the inferior belly of the omohyoideus, the external jugular vein, and the transverse cervical artery. It emerges between the scalene anterior and medius. Its upper part lies above the third part of the subclavian artery, while the trunk formed by the union of the 8th cervical and 1st thoracic is placed behind the artery. The plexus next passes behind the clavicle, the subclavius, and the transverse scapular vessels, and lies upon the first digitation of the serratus anterior and the subscapularis. In the axilla it is placed lateral to the first portion of the axillary artery. It surrounds the second part of the artery, one cord lying medial to it, one lateral to it, and one behind it. At the lower part of the axilla it gives off its terminal branches to the upper limb. Branches of communication. Close to their exit from the intervertebral foramina, the 5th and 6th cervical nerves each receive a grey ramus communicans from the middle cervical ganglion of the sympathetic trunk, and the 7th and 8th cervical similar twigs from the inferior ganglion. The 1st thoracic nerve receives a grey ramus from, and contributes a white ramus to, the 1st thoracic ganglion. On the scalenus anterior, the phrenic nerve is joined by branches from the 5th cervical. Branches of distribution. The branches of distribution of the brachial plexus may be arranged into two groups, viz., those given off above and those below the clavicle. Supraclavicular branches. Dorsal scapula 5C, suprascapular 5-6C, nerve to subclavius 5-6C, long thoracic 5-6-7C, to longus colli and scalene 5-6-7-8C. End of section 36.
Seven of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by M.L. Cohen. Anatomy of the Human Body Part 4 by Henry Gray. Anterior divisions of the spinal nerves, Part 2. The dorsal scapular nerve, nervus dorsalis scapulae, nerve to the rhomboideae, posterior scapular nerve, arises from the 5th cervical, pierces the scalenus medius, passes beneath the levator scapulae, to which it occasionally gives a twig, and ends in the rhomboideae. The suprascapular, nervus suprascapularis, arises from the trunk formed by the union of the 5th and 6th cervical nerves. It runs lateralward beneath the trapezius and omohyoideus, and enters the supraspinatus fossa through the suprascapular notch, below the superior transverse scapular ligament. It then passes beneath the supraspinatus and curves around the lateral border of the spine of the scapula to the infraspinatus fossa. In the supraspinatus fossa, it gives off two branches to the supraspinatus muscle and an articular filament to the shoulder joint, and in infraspinatus fossa, it gives off two branches to the infraspinatus muscle, besides some filaments to the shoulder joint and scapula. The nerve to the subclavius, nervus subclavius, is a small filament which arises from the point of junction of the 5th and 6th cervical nerves. It descends to the muscle in front of the third part of the subclavian artery and the lower trunk of the plexus, and is usually connected by a filament with the phrenic nerve. The long thoracic nerve, nervus thoracalis longus, external respiratory nerve of Bell, posterior thoracic nerve, supplies the serratus anterior. It usually arises by three roots from the 5th, 6th, and 7th cervical nerves, but the root from the 7th nerve may be absent. The roots from the 5th and 6th nerves pierce the scalenus medius, while that from the 7th passes in front of the muscle. The nerve descends beneath the brachial plexus and the axillary vessels, resting on the outer surface of the serratus anterior. It extends along the side of the thorax to the lower border of that muscle, supplying filaments to each of its digitations. The branches for the longus colli and scaleni arise from the lower 4 cervical nerves at their exit from the intervertebral foramina. Infraclavicular branches. The infraclavicular branches are derived from the 3 cords of the brachial plexus, but the fasciculi of the nerves may be traced through the plexus to the spinal nerves from which they originate. They are as follows: musculocutaneous, 5th, 6th, and 7th cervical, lateral cord, lateral anterior thoracic, 5th, 6th, and 7th, lateral head of the median, 6th and 7th, medial anterior thoracic, Medial antebrachial cutaneous, 6 and 7. Medial cord, medial brachial cutaneous, 8th cervical, 1st thoracic. Ulnar, medial head of median, also 8th cervical, 1st thoracic. Upper subscapular, 5th and 6th cervical. Lower subscapular, 5th and 6th cervical. Posterior cord, thoracodorsal, 5th, 6th, and 7th cervical. Axillary, 5th and 6th cervical. Radial, 6th, 7th, 8th cervical, 1st thoracic. The anterior thoracic nerves, nervus thoracalis anteriores, supply the pectoralis major and minor. The lateral anterior thoracic, fasciculus lateralis, the larger of the two, arises from the lateral cord of the brachial plexus, and through it from the 5th, 6th, and 7th cervical nerves. It passes around the axillary artery and vein, pierces the corticoclavicular fascia, and is distributed to the deep surface of the pectoralis major. It sends a filament to join the medial anterior thoracic and form with it a loop in front of the first part of the axillary artery. The medial anterior thoracic, fasciculus medialis, arises from the medial cord of the plexus and through it from the 8th cervical and 1st thoracic. It passes behind the first part of the axillary artery, curves forward between the axillary artery and vein, and unites in front of the artery with a filament from the lateral nerve. It then enters the deep surface of the pectoralis minor, where it divides into a number of branches which supply the muscle. 2 or 3 branches pierce the muscle and end in the pectoralis major. The subscapular nerves, nervus subscapularis, 2 in number, spring from the posterior cord of the plexus and through it from the 5th and 6th cervical nerves. The upper subscapular, short subscapular, the smaller enters the upper part of the subscapularis and is frequently represented by 2 branches. The lower subscapular supplies the lower part of the subscapularis and ends in the teres major. The latter muscle is sometimes supplied by a separate branch. The thoracodorsal nerve, nervus thoracolodorsalis, middle or long subscapular nerve. A branch of the posterior cord of the plexus derives its fibers from the 5th, 6th, and 7th cervical nerves. It follows the course of the subscapular artery along the posterior wall of the axilla to the latissimus dorsi, in which it may be traced as far as the lower border of that muscle. The axillary nerve, nervus axillaris, circumflex nerve, arises from the posterior cord of the brachial plexus, and its fibers are derived from the 5th and 6th cervical nerves. It lies at first behind the axillary artery and in front of the subscapularis, and passes downward to the lower border of that muscle. It then winds backwards in company with the posterior humeral circumflex artery through a quadrilateral space bounded above by the subscapularis, below by the teres major, medially by the long head of the triceps brachii, and laterally by the surgical neck of the humerus, and divides into an anterior and a posterior branch. The anterior branch, upper branch, lies around the cervical neck of the humerus beneath the deltoideus, with the posterior humeral circumflex vessels as far as the anterior border of that muscle, supplying it and giving off a few small cutaneous branches which pierce the muscle and ramify in the skin covering its lower part. The posterior branch, lower branch, supplies the teres minor and the posterior part of the deltoideus. Upon the branch to the teres minor, an oval enlargement, pseudoganglion, usually exists. The posterior branch then pierces the deep fascia and is continued as the lateral brachial cutaneous nerve, which sweeps around the posterior border of the deltoideus and supplies the skin over the lower 2/3 of the posterior part of this muscle, as well as that covering the long head of the triceps brachii. The trunk of the axillary nerve gives off an articular filament which enters the shoulder joint below the subscapularis. The musculocutaneous nerve, nervus musculocutaneous, arises from the lateral cord of the brachial plexus opposite the lower border of the pectoralis minor, its fibers being derived from the 5th, 6th, and 7th cervical nerves. It pierces the coracobrachialis muscle and passes obliquely between the biceps brachii and the brachialis to the lateral side of the arm. A little above the elbow, it pierces the deep fascia lateral to the tendon of the biceps brachii and is continued into the forearm as the lateral antebrachial cutaneous nerve. In its course through the arm, it supplies the coracobrachialis, biceps brachii, and the greater part of the brachialis. The branch to the coracobrachialis is given off from the nerve close to its origin, and in some instances as a separate filament from the lateral cord of the plexus. It is derived from the 7th cervical nerve. The branches to the biceps brachii and brachialis are given off after the musculocutaneous has pierced the coracobrachialis. That supplying the brachialis gives a filament to the elbow joint. The nerve also sends a small branch to the bone, which enters the nutrient foramen with the accompanying artery. The lateral antebrachial cutaneous nerve, Nervus cutaneous antebrachii, cutaneous lateralis, branch of the musculocutaneous nerve, passes behind the cephalic vein and divides opposite the elbow joint into a volar and a dorsal branch. The volar branch, ramus volaris anterior branch, descends along the radial border of the forearm to the wrist and supplies the skin over the lateral half of its volar surface. At the wrist joint, it is placed in front of the radial artery and some filaments piercing the deep fascia accompanying that vessel to the dorsal surface of the carpus. The nerve then passes downward to the ball of the thumb, where it ends in cutaneous filaments. It communicates with the superficial branch of the radial nerve and with the palmar cutaneous branch of the median nerve. The dorsal branch, ramus dorsalis posterior branch, descends along the dorsal surface of the radial side of the forearm to the wrist. It supplies the skin of the lower two-thirds of the dorsolateral surface of the forearm, communicating with the superficial branch of the radial nerve and the dorsal antebrachial cutaneous branch of the radial. The musculocutaneous nerve presents frequent irregularities. It may adhere for some distance to the median and then pass outward beneath the biceps brachii instead of through the coracobrachialis. Some of the fibers of the median may run for some distance in the musculocutaneous and then leave it to join their proper trunk. Less frequently, the reverse is the case, and the median sends a branch to join the musculocutaneous. The nerve may pass under the coracobrachialis or through the biceps brachii. Occasionally, it gives a filament to the pronator teres, and it supplies the dorsal surface of the thumb when the superficial branch of the radial nerve is absent. The medial antebrachial cutaneous nerve, Nervus cutaneous antebrachial medialis, internal cutaneous nerve, arises from the medial cord of the brachial plexus. It derives its fibers from the 8th cervical and 1st thoracic nerves and, at its commencement, is placed medial to the axillary artery. It gives off, near the axilla, a filament which pierces the fascia and supplies the integument covering the biceps brachii, nearly as far as the elbow. The nerve then runs down the ulnar side of the arm, medial to the brachial artery, pierces the deep fascia with the basilic vein, about the medial of the arm, and divides into a volar and an ulnar branch. The volar branch, ramus volaris anterior branch, the larger, passes usually in front of but occasionally behind the vena mediana cubiti, median basilic vein. It then descends on the front of the ulnar side of the forearm, distributing filaments to the skin as far as the wrist and communicating with the palmar cutaneous branch of the ulnar nerve. The ulnar branch, ramus ulnaris posterior branch, passes obliquely downward on the medial side of the basilic vein, in front of the medial epicondyle of the humerus, to the back of the forearm, and then descends on its ulnar side as far as the wrist, distributing filaments to the skin. It communicates with the medial brachial cutaneous, the dorsal antebrachial cutaneous branch of the radial, and the dorsal branch of the ulnar. The medial brachial cutaneous nerve, Nervus cutaneous brachii medialis, lesser internal cutaneous nerve, nerve of Risberg, is distributed to the skin on the ulnar side of the arm. It is the smallest branch of the brachial plexus, and arising from the medial cord receives its fibers from the 8th cervical and 1st thoracic nerves. It passes through the axilla, at first lying behind and then medial to the axillary vein, and communicates with the intercostobrachial nerve. It descends along the medial side of the brachial artery to the middle of the arm, where it pierces the deep fascia and is distributed to the skin of the back of the lower third of the arm, extending as far as the elbow, where some filaments are lost in the skin in front of the medial epicondyle and others over the olecranon. It communicates with the ulnar branch of the medial antebrachial cutaneous nerve. In some cases, the medial brachiocutaneous and intercostobrachial are connected by 2 or 3 filaments, which form a plexus in the axilla. In other cases, the intercostobrachial is of large size and takes the place of the medial brachiocutaneous, receiving merely a filament of communication from the brachial plexus, which represents the latter nerve. In a few cases, this filament is lacking. End of section 37. Anatomy Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by M.L. Cohen. Anatomy of the Human Body Part 4 by Henry Gray. Anterior Divisions of the Spinal Nerves Part 3. The median nerve, Nervus medianus, extends along the middle of the arm and forearm to the hand. It arises by two roots, one from the lateral and one from the medial cord of the brachial plexus. These embrace the lower part of the axillary artery, uniting either in front of or lateral to that vessel. Its fibers are derived from the 6th, 7th, and 8th cervical and 1st thoracic nerves. As it descends through the arm, it lies at first lateral to the brachial artery, about the level of the insertion of the coracobrachialis. It crosses the artery, usually in front of but occasionally behind it, and lies on the medial side at the bend of the elbow, where it is situated behind the laceratus fibrosus, bicipital fascia, and is separated from the elbow joint by the brachialis. In the forearm, it passes between the two heads of the pronator teres and crosses the ulnar artery but is separated from this vessel by the deep head of the pronator teres. It descends beneath the flexor digitorum sublimis, lying on the flexor digitorum profundus to within 5 centimeters of the transverse carpal ligament. Here it becomes more superficial and is situated between the tendons of the flexor digitorum sublimis and flexor carporadialis. In this situation, it lies behind, and rather to the radial side of, the tendon of the palmaris longus, and is covered by the skin and fascia. It then passes behind the transverse carpal ligament into the palm of the hand. In its course, through the forearm, it is accompanied by the median artery, a branch of the volar interosseous artery. With the exception of the nerve to the pronator teres, which sometimes arises above the elbow joint, the median nerve gives off no branches in the arm. As it passes in front of the elbow, it supplies 1 or 2 twigs to the joint. In the forearm, its branches are muscular, volar interosseous, and palmar. The muscular branches, rami musculares, are derived from the nerve near the elbow and supply all of the superficial muscles on front of the forearm except the flexor carpi ulnaris. The volar interosseous nerve, nervus interosseous antebrachiovolaris, anterior interosseous nerve, supplies the deep muscles on the front of the forearm except the ulnar half of the flexor digitorum profundus. It accompanies the volar interosseous artery along the front of the interosseous membrane in the interval between the flexor pollicis longus and flexor digitorum profundus, supplying the whole of the former and the radial half of the latter, and ending below in the pronator quadratus and wrist joint. The palmar branch, ramus cutaneous palmaris, nervus mediani, of the median nerve arises at the lower part of the forearm. It pierces the volar carpal ligament and divides into a lateral and a medial branch. The lateral branch supplies the skin over the ball of the thumb and communicates with the volar branch of the lateral antebrachial cutaneous nerve. The median branch supplies the skin of the palm and communicates with the palmar cutaneous branch of the ulnar. In the palm of the hand, the median nerve is covered by the skin and the palmar aponeuroses, and rests on the tendons of the flexor muscles. Immediately after emerging from under the transverse carpal ligament, the nerve becomes enlarged and flattened and splits into a smaller lateral and larger medial portion. The lateral portion supplies a short, stout branch to certain of the muscles of the ball of the thumb, that is, the abductor brevis, the opponens, and the superhead of the flexor brevis, and then divides into 3 proper volar digital nerves. 2 of these supply the sides of the thumb, while the third gives a twig to the third lumbricalis and is distributed to the radial side of the index finger. The medial portion of the nerve divides into 2 common volar digital nerves. The first of these gives a twig to the second lumbricalis and runs toward the cleft between the index and middle fingers, where it divides into 2 proper digital nerves for the adjoining side of these digits. The second runs towards the cleft between the middle and ring fingers and splits into 2 proper digital nerves for the adjoining sides of these digits. It communicates with a branch from the ulnar nerve and sometimes sends a twig to the third lumbricalis. Each proper digital nerve, opposite the base of the first phalanx, gives off a dorsal branch which joins the dorsal digital nerve from the superficial branch of the radial nerve and supplies the integument on the dorsal aspect of the last phalanx. At the end of the digit, the proper digital nerve divides into 2 branches, one of which supplies the pulp of the finger, the other ramifies around and beneath the nail. The proper digital nerves, as they run along the fingers, are placed superficial to the corresponding arteries. The ulnar nerve, nervus ulnaris, is placed along the medial side of the limb and is distributed to the muscles and skin of the forearm and hand. It arises from the medial cord of the brachial plexus and derives its fibers from the 8th cervical and 1st thoracic nerves. It is smaller than the median and lies at first behind it but diverges from it in its course down the arm. At its origin, it lies medial to the axillary artery and bears the same relation to the brachial artery as far as the middle of the arm. Here, it pierces the medial intramuscular septum, runs obliquely across the medial head of the triceps brachii, and descends to the groove between the medial epicondyle and the olecranon, accompanied by the superior ulnar collateral artery. At the elbow, It rests upon the back of the medial epicondyle and enters the forearm between the two heads of the flexor carpi ulnaris. In the forearm, it descends along the ulnar side lying upon the flexor digitorum profundus. Its upper half is covered by the flexor carpi ulnaris. Its lower half lies on the lateral side of the muscle, covered by the integument and fascia. In the upper third of the forearm, it is separated from the ulnar artery by a considerable interval, but in the rest of its extent lies close to the medial side of the artery. About 5 centimeters above the wrist, it ends by dividing into a dorsal and a volar branch. The branches of the ulnar nerve are articular to the elbow joint, muscular, palmar cutaneous, dorsal, and volar. The articular branches to the elbow joint are several small filaments which arise from the nerve as it lies in the groove between the medial epicondyle and the olecranon. The muscular branches, rami musculares, 2 in number, arise near the elbow. One supplies the flexor carpi ulnaris, the other the ulnar half of the flexor digitorum profundus. The palmar cutaneous branch, ramus cutaneous palmaris, arises about the middle of the forearm and descends on the ulnar artery, giving off some filaments to the vessel. It perforates the volar carpal ligament and ends in the skin of the palm, communicating with the palmar branch of the median nerve. The dorsal branch, ramus dorsalis manus, arises about 5 centimeters above the wrist. It passes backward beneath the flexor carpi ulnaris, perforates the deep fascia, and, running along the ulnar side of the back of the wrist and hand, divides into 2 dorsal digital branches. One supplies the ulnar side of the little finger, the other the adjacent sides of the little and ring fingers. It also sends a twig to join that given by the superficial branch of the radial nerve for adjoining sides of the middle and ring fingers, and assists in supplying them. A branch is distributed to the metacarpal region of the hand, communicating with the twig of the superficial branch of the radial nerve. On the little finger, the dorsal digital branches extend only as far as the base of the terminal phalanx, and on the ring finger as far as the base of the second phalanx. The more distal parts of these digits are supplied by dorsal branches derived from the proper volar digital branches of the ulnar nerve. The volar branch, ramus volaris manus, crosses the transverse carpal ligament on the lateral side of the pisiform bone, medial and a little behind the ulnar artery. It ends by dividing into a superficial and a deep branch. The superficial branch, ramus superficialis, nerve ulnaris, supplies the palmaris brevis and the skin on the ulnar side of the hand, and divides into a proper volar digital branch for the ulnar side of the little finger, and the common volar digital branch which gives a communicating twig to the median nerve and divides into 2 proper digital nerves for the adjoining sides of the little and ring fingers. The proper digital branches are distributed to the fingers in the same manner as those of the median. The deep branch, ramus profundus, accompanied by the deep branch of the ulnar artery, passes between the abductor digiti quinti and flexor digiti quinti brevis. It then perforates the opponens digitis quinti and follows the course of the deep volar arch beneath the flexor tendons. At its origin, it supplies the 3 short muscles of the little finger. As it crosses the deep part of the hand, it supplies all the interossei and the 3rd and 4th lumbricales. It ends by supplying the adductores pollicis and the medial head of the flexor pollicis brevis. It also sends articular filaments to the wrist joint. It has been pointed out that the ulnar part of the flexor digitorum profundus is supplied by the ulnar nerve. The 3rd and 4th lumbricales, which are connected with the tendons of this part of the muscle, are supplied by the same nerve. In a like manner, the lateral part of the flexor digitorum profundus and the 1st and 2nd lumbricales are supplied by the median nerve. The 3rd lumbricalis frequently receives an additional twig from the median nerve. The radial nerve, nervus radialis musculospiral nerve, the largest branch of the brachial plexus, is the continuation of the posterior cord of the plexus. Its fibers are derived from the 5th, 6th, 7th, and 8th cervical and 1st thoracic nerves. It descends behind the first part of the axillary artery and the upper part of the brachial artery, and in front of the tendons of the latissimus dorsi and teres major. It then winds around from the medial to lateral side of the humerus in a groove with the arteriae profundae brachii, between the medial and lateral heads of the triceps brachii. It pierces the lateral intermuscular septum and passes between the brachialis and brachioradialis to the front of the lateral epicondyle, where it divides into a superficial and deep branch. The branches of the musculospiral nerve are muscular, superficial, cutaneous, deep. The muscular branches, ramus musculares, supply the triceps brachii and coneus, brachioradialis, extensor carpi radialis longus, and brachialis, and are grouped as medial, posterior, and lateral. The medial muscular branches supply the medial and long heads of the triceps brachii. That to the medial head is a long, slender filament, which lies close to the ulnar nerve as far as the lower third of the arm, and is therefore frequently spoken of as the ulnar collateral nerve. The posterior muscular branch, of large size, arises from the nerve in the groove between the triceps brachii and the humerus. It divides into filaments which supply the medial and lateral heads of the triceps brachii and the anconeus muscles. The branch for the lateral muscle is a long, slender filament which descends in the substance of the medial head of the triceps brachii. The lateral muscular branches supply the brachioradialis, extensor carpi radialis longus, and the lateral part of the brachialis. The cutaneous branches are two in number, the posterior brachial cutaneous and the dorsal antibrachial cutaneous. The posterior brachial cutaneous nerve, nervus cutaneous brachii posterior, internal cutaneous branch of musculospiral, arises in the axilla with the medial muscular branch. It is of small size and passes through the axilla to the medial side of the area, supplying the skin on its dorsal surface nearly as far as the olecranon. In its course, it crosses behind and communicates with the intercostobrachial. The dorsal antibrachial cutaneous nerve, nervus cutaneous antibrachial dorsalis, external cutaneous branch of the musculospiral, perforates the lateral head of the triceps brachii at its attachment to the humerus. The upper and smaller branch of the nerve passes to the front of the elbow, lying close to the cephalic vein, and supplies the skin of the lower half of the arm. The lower branch pierces the deep fascia below the insertion of the deltoideus, and descends along the lateral side of the arm and elbow, and then along the back of the forearm to the wrist, supplying the skin in its course and joining near its termination with the dorsal branch of the lateral antibrachial cutaneous nerve. The superficial branch of the radial nerve, ramus superficialis radial nerve, passes along the front of the radial side of the forearm to the commencement of its lower third. It lies at first slightly lateral to the radial artery, concealed beneath the brachioradialis. In the middle third of the forearm, it lies behind the same muscle, close to the lateral side of the artery. It quits the artery about 7 centimeters above the wrist, passes beneath the tendon of the brachioradialis, and, piercing the deep fascia, divides into two branches. The lateral branch, the smaller, supplies the skin of the radial side and ball of the thumb, joining with the volar branch of the lateral antibrachial cutaneous nerve. The medial branch communicates above the wrist with the dorsal branch of the lateral antibrachial cutaneous and, on the back of the hand, with the dorsal branch of the ulnar nerve. It then divides into 4 digital nerves, which are distributed as follows. The first supplies the ulnar side of the thumb, the second, the radial side of the index finger, the third, the adjoining sides of the index and middle fingers, the fourth communicates with the filament from the dorsal branch of the ulnar nerve and supplies the adjacent sides of the middle and ring fingers. See footnote. According to Hutchison, the digital nerve to the thumb reaches only as high as the root of the nail, the one to the forefinger as high as the middle of the second phalanx, and the one to the middle and ring fingers not higher than the first phalangeal joint. End footnote. The deep branch of the radial nerve, nervus interosseous dorsalis, dorsal or posterior interosseous nerve, winds to the back of the forearm around the lateral side of the radius between the two planes of fibers of the supinator, and is prolonged downward between the superficial and deep layers of the muscles to the middle of the forearm. Considerably diminished in size, it descends, as the dorsal interosseous nerve, on the interosseous membrane in front of the extensor pollicis longus to the back of the carpus, where it presents a gangliform enlargement from which filaments are distributed to the ligaments and articulations of the carpus. It supplies all the muscles on the radial side and dorsal surface of the forearm, excepting the anconeus, brachioradialis, and extensor carpi radialis longus. End of section 38.
Section 39 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4, by Henry Gray. The Thoracic Nerves. 6C. The Thoracic Nerves, Nervi thoracalis. The anterior divisions of the thoracic nerves, rami anterioris, ventral divisions, are 12 in number on either side. 11 of them are situated between the ribs, and are therefore termed intercostal. The 12th lies below the last rib. Each nerve is connected with the adjoining ganglion of the sympathetic trunk by a gray and a white ramus communicans. The intercostal nerves are distributed chiefly to the parietes of the thorax and abdomen, and differ from the anterior divisions of the other spinal nerves in that each pursues an independent course, i.e., there is no plexus formation. The first two nerves supply fibers to the upper limb in addition to their thoracic branches. The next four are limited in their distribution to the parietes of the thorax. The lower five supply the parietes of the thorax and abdomen. The 12th thoracic is distributed to the abdominal wall and the skin of the buttock. The first thoracic nerve. The anterior division of the first thoracic nerve divides into two branches. One, the larger, leaves the thorax in front of the neck of the first rib and enters the brachial plexus. The other and smaller branch, the first intercostal nerve, runs along the first intercostal space, and ends on the front of the chest as the first anterior cutaneous branch of the thorax. Occasionally this anterior cutaneous branch is wanting. The first intercostal nerve, as a rule, gives off no lateral cutaneous branch, but sometimes it sends a small branch to communicate with the intercostobrachial. From the second thoracic nerve it frequently receives a connecting twig, which ascends over the neck of the second rib. The upper thoracic nerves, nervi intercostalis. The anterior divisions of the second, third, fourth, fifth, and sixth thoracic nerves, and the small branch from the first thoracic, are confined to the parietes of the thorax, and are named thoracic intercostal nerves. They pass forward in the intercostal spaces below the intercostal vessels. At the back of the chest they lie between the pleura and the posterior intercostal membranes, but soon pierce the latter and run between the two planes of intercostal muscles as far as the middle of the rib. They then enter the substance of the intercostalis interni, and, running amidst their fibers as far as the costal cartilages, they gain the inner surfaces of the muscles and lie between them and the pleura. Near the sternum they cross in front of the internal mammary artery and transversus thoracis muscle, pierce the intercostalis interni, the anterior intercostal membranes, and pectoralis major, and supply the integument of the front of the thorax and over the mamma, forming the anterior cutaneous branches of the thorax. The branch from the second nerve unites with the anterior supraclavicular nerves of the cervical plexus. Branches. Numerous slender muscular filaments supply the intercostalis, the subcostalis, the levator costarum, the serratus posterior superior, and the transversus thoracis. At the front of the thorax some of these branches cross the costal cartilages from one intercostal space to another. Lateral cutaneous branches, rami cutanei lateralis, are derived from the intercostal nerves about midway between the vertebrae and sternum. They pierce the intercostalis externi and serratus anterior, and divide into anterior and posterior branches. The anterior branches run forward to the side and the forepart of the chest, supplying the skin and the mamma. Those of the fifth and sixth nerves supply the upper digitations of the obliquus externus abdominis. The posterior branches run backward, and supply the skin over the scapula and latissimus dorsi. The lateral cutaneous branch of the second intercostal nerve does not divide, like the others, into an anterior and a posterior branch. It is named the intercostobrachial nerve. It pierces the intercostalis externus and the serratus anterior, crosses the axilla to the medial side of the arm, and joins with a filament from the medial brachial cutaneous nerve. It then pierces the fascia and supplies the skin of the upper half of the medial and posterior part of the arm, communicating with the posterior brachial cutaneous branch of the radial nerve. The size of the intercostobrachial nerve is in inverse proportion to that of the medial brachial cutaneous nerve. A second intercostobrachial nerve is frequently given off from the lateral cutaneous branch of the third intercostal. It supplies filaments to the axilla and medial side of the arm. The lower thoracic nerves. The anterior divisions of the 7th, 8th, 9th, 10th, and 11th thoracic nerves are continued anteriorly from the intercostal spaces into the abdominal wall. Hence they are named thoracico-abdominal intercostal nerves. They have the same arrangement as the upper ones as far as the anterior ends of the intercostal spaces, where they pass behind the costal cartilages and between the obliquus internus and transversus abdominis to the sheath of the rectus abdominis, which they perforate. They supply the rectus abdominis and end as the anterior cutaneous branches of the abdomen. They supply the skin of the front of the abdomen. The lower intercostal nerves supply their intercostalis and abdominal muscles. The last three send branches to the serratus posterior inferior. About the middle of their course they give off lateral cutaneous branches. These pierce the intercostalis externi and the obliquus externus abdominis in the same line as the lateral cutaneous branches of the upper thoracic nerves, and divide into anterior and posterior branches, which are distributed to the skin of the abdomen and back. The anterior branches supply the digitations of the obliquus externus abdominis, and extend downward and forward nearly as far as the margin of the rectus abdominis. The posterior branches pass backward to supply the skin over the latissimus dorsi. The anterior division of the 12th thoracic nerve is larger than the others. It runs along the lower border of the 12th rib, often gives a communicating branch to the first lumbar nerve, and passes under the lateral lumbocostal arch. It then runs in front of the quadratus lumborum, perforates the transversus, and passes forward between it and the obliquus internus, to be distributed in the same manner as the lower intercostal nerves. It communicates with the ilio-hypogastric nerve of the lumbar plexus, and gives a branch to the pyramidalis. The lateral cutaneous branch of the last thoracic nerve is large, and does not divide into an anterior and a posterior branch. It perforates the obliqui internus and externus, descends over the iliac crest in front of the lateral cutaneous branch of the ilio-hypogastric, and is distributed to the skin of the front part of the gluteal region, some of its filaments extending as low as the greater trochanter. End of section 39. Recording by Leanne Howlett.
Section 40 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Reading by Bologna Times. Anatomy of the Human Body, Part 4, by Henry Gray. The Lumbosacral Plexus. The lumbosacral plexus, Plexus lumbosacralis. The anterior divisions of the lumbar, sacral, and coccygeal nerves form the lumbosacral plexus, the first lumbar nerve being frequently joined by a branch from the 12th thoracic. For descriptive purposes, this plexus is usually divided into three parts, the lumbar, sacral, and pudendal plexuses. The lumbar nerves, nervus lumbalis. The anterior divisions of the lumbar nerves, rami anterioris, increase in size from above downward. They are joined near the origins by gray rami communicantes from the lumbar ganglia of the sympathetic trunk. These rami consist of long, slender branches which accompany the lumbar arteries around the sides of the vertebral bodies, beneath the zoas major. Their arrangement is somewhat irregular. One ganglion may give rami to two lumbar nerves, or one lumbar nerve may receive rami from two ganglia. The first and second, and sometimes the third and fourth lumbar nerves are each connected with the lumbar part of the sympathetic trunk by a white ramus communicans. The nerves pass obliquely outward behind the psoas major, or between its fasciculi, distributing filaments to it and the quadratus lumborum. The first three and the greater part of the fourth are connected together in this situation by anastomotic loops, and form the lumbar plexus. The smaller part of the fourth joins with the fifth to form the lumbosacral trunk, which assists in the formation of the sacral plexus. The fourth nerve is named the nervus furcalis from the fact that it is subdivided between the two plexuses. The lumbar plexus (plexus lumbalis). The lumbar plexus is formed by the loops of communication between the anterior divisions of the first three and the greater part of the fourth lumbar nerves. The first lumbar often receives a branch from the last thoracic nerve. It is situated in the posterior part of the zoas major, in front of the transverse processes of the lumbar vertebrae. The mode in which the plexus is arranged varies in different subjects. It differs from the brachial plexus in not forming an intricate interlacement, but the several nerves of distribution arise from one or more of the spinal nerves, in the following manner. The first lumbar nerve, frequently supplemented by a twig from the last thoracic, splits into an upper and lower branch. The upper and larger branch divides into the iliohypogastric and ilioinguinal nerves. The lower and smaller branch unites with a branch of the second lumbar to form the genitofemoral nerve. The remainder of the second nerve and the third and fourth nerves divide into ventral and dorsal divisions. The ventral division of the second unites with the ventral divisions of the third and fourth nerves to form the Obturator Nerve. The dorsal divisions of the second and third nerves divide into two branches, a smaller branch from each uniting to form the lateral femoral cutaneous nerve, and a larger branch from each joining with the dorsal division of the fourth nerve to form the femoral nerve. The accessory obturator, when it exists, is formed by the union of two small branches given off from the third and fourth nerves. The branches of the lumbar plexus may therefore be arranged as follows: iliohypogastric, first lumbar; ilioinguinal, first lumbar; genitofemoral, first, second lumbar. Dorsal divisions: lateral femoral cutaneous, second and third lumbar; femoral, second, third, fourth lumbar. Ventral divisions: obturator, second, third, and fourth lumbar; accessory obturator, third and fourth lumbar. The iliohypogastric nerve, nervus iliohypogastricus, arrives from the first lumbar nerve. It emerges from the upper part of the lateral border of the psoas major, and crosses obliquely in front of the quadratus lumborum to the iliac crest. It then perforates the posterior part of the transversus abdominis near the crest of the ilium, and divides between that muscle and the obliquus internus abdominis into a lateral and an anterior cutaneous branch. The lateral cutaneous branch, ramus cutaneous lateralis, iliac branch, pierces the oblique internus and externus immediately above the iliac crest, and is distributed to the skin of the gluteal region, behind the lateral cutaneous branch of the last thoracic nerve. The size of this branch bears an inverse proportion to that of the lateral cutaneous branch of the last thoracic nerve. The anterior cutaneous branch, ramus cutaneous anterior hypogastric branch, continues onward between the obliquus internus and transversus. It then pierces the obliquus internus, becomes cutaneous by perforating the aponeurosis of the obliquus externus about 2.5 cm above the subcutaneous inguinal ring, and is distributed to the skin of the hypogastric region. The iliohypogastric nerve communicates with the last thoracic and ilioinguinal nerves. The ilioinguinal nerve, nervus ilioinguinalis, smaller than the preceding, arises with it from the first lumbar nerve. It emerges from the lateral border of the psoas major, just below the iliohypogastric, and, passing obliquely across the quadratus lumbarum and iliacus, it perforates the transversus abdominis near the anterior part of the iliac crest, and communicates with the iliohypogastric nerve between the transversus and the obliquus internus. The nerve then pierces the obliquus internus, distributing filaments to it, and, accompanying the spermatic cord through the subcutaneous inguinal ring, is distributed to the skin of the upper and medial part of the thigh, to the skin over the root of the penis and upper part of the scrotum in the male, and to the skin covering the mons pubis and labium majus in the female. The size of this nerve is in inverse proportion to that of the iliohypogastric. Occasionally it is very small, and ends by joining the iliohypogastric. In such cases, a branch from the iliohypogastric takes the place of the ilioinguinal, or the latter nerve may be altogether absent. The genitofemoral nerve, nervus genitofemoralis, genitocrural nerve, arises from the first and second lumbar nerves. It passes obliquely through the substance of the psoas major, and emerges from its medial border, close to the vertebral column, opposite the fibrocartilage between the third and fourth lumbar vertebrae. It then descends on the surface of the psoas major under cover of the peritoneum, and divides into the external spermatic and lumboinguinal nerves. Occasionally these two nerves emerge separately through the substance of the psoas. The external spermatic nerve, nervus spermaticus externus, genital branch of genitofemoral, passes outward on the psoas major, and pierces the fascia transversalis, or passes through the abdominal inguinal ring. It then descends behind the spermatic cord to the scrotum, supplies the cremaster, and gives a few filaments to the skin of the scrotum. In the female, it accompanies the round ligament of the uterus, and is lost upon it. The lumboinguinal nerve, nervus lumboinguinalis, femoral or crural branch of genitofemoral, descends on the external iliac artery, sending a few filaments around it, and, passing beneath the inguinal ligament, enters the sheath of the femoral vessels, lying superficial and lateral to the femoral artery. It pierces the anterior layer of the sheath of the vessels and the fascia lata, and supplies the skin of the anterior surface of the upper part of the thigh. On the front of the thigh it communicates with the anterior cutaneous branches of the femoral nerve. A few filaments from the lumboinguinal nerve may be traced to the femoral artery. The lateral femoral cutaneous nerve, nervus cutaneous femoralis lateralis, external cutaneous nerve, arises from the dorsal divisions of the second and third lumbar nerves. It emerges from the lateral border of the psoas major about its middle, and crosses the iliacus obliquely toward the anterior superior iliac spine. It then passes under the inguinal ligament and over the sartorius muscle into the thigh, where it divides into two branches, an anterior and a posterior. The anterior branch becomes superficial about 10 cm below the inguinal ligament, and divides into branches which are distributed to the skin of the anterior and lateral parts of the thigh, as far as the knee. The terminal filaments of this nerve frequently communicate with the anterior cutaneous branches of the femoral nerve, and with the infrapatellar branch of the saphenous nerve, forming with them the patellar plexus. The posterior branch pierces the fascia lata and subdivides into filaments which pass backward across the lateral and posterior surfaces of the thigh, supplying the skin from the level of the greatest trochanter to the middle of the thigh. The obturator nerve, Nervus obturatoris, arises from the ventral divisions of the second, third, and fourth lumbar nerves. The branch from the third is the largest, while that from the second is often very small. It descends through the fibers of the psoas major, and emerges from its medial border near the brim of the pelvis. It then passes behind the common iliac vessels, and on the lateral side of the hypogastric vessels and ureter, which separate it from the ureter, and runs along the lateral wall of the lesser pelvis, above and in front of the obturator vessels, to the upper part of the obturator foramen. Here it enters the thigh, and divides into an anterior and a posterior branch, which are separated at first by some of the fibers of the obturator externus, and lower down by the abductor brevis. The anterior branch, ramus anterior, leaves the pelvis in front of the obturator externus, and descends in front of the adductor brevis, and behind the pectineus and adductor longus. At the lower border of the latter muscle it communicates with the anterior cutaneous and saphenous branches of the femoral nerve, forming a kind of plexus. It then descends upon the femoral artery, to which it is finally distributed. Near the obturator foramen the nerve gives off an articular branch to the hip joint. Behind the pectineus it distributes branches to the adductor longus and gracilis, and usually to the adductor brevis, and in rare cases to the pectineus. It receives a communicating branch from the accessory obturator nerve when that nerve is present. Occasionally the communicating branch to the anterior cutaneous and saphenous branches of the femoral is continued down, as a cutaneous branch, to the thigh and leg. When this is so, it emerges from beneath the lower border of the adductor longus, descends along the posterior margin of the sartorius to the medial side of the knee, where it pierces the deep fascia, communicates with the saphenous nerve, and is distributed to the skin of the tibial side of the leg as low down as its middle. The posterior branch, ramus posterior, pierces the anterior part of the obturator externus, and supplies this muscle. It then passes behind the adductor brevis on the front of the adductor magnus, where it divides into numerous muscular branches which are distributed to the adductor magnus and the adductor brevis when the latter does not receive a branch from the anterior division of the nerve. It usually gives off an articular filament to the knee joint. The articular branch for the knee joint is sometimes absent. It either perforates the lower part of the adductor magnus, or passes through the opening which transmits the femoral artery, and enters the popliteal fossa. It then descends upon the popliteal artery as far as the back part of the knee joint, where it perforates the oblique popliteal ligament, and is distributed to the synovial membrane. It gives filaments to the popliteal artery. The accessory obturator nerve, Nervus obturatorius accessorius, is present in about 29% of cases. It is of small size and arises from the ventral divisions of the third and fourth lumbar nerves. It descends along the medial border of the psoas major, crosses the superior ramus of the pubis, and passes under the pectineus, where it divides into numerous branches. One of these supplies the pectineus, penetrating its deep surface. Another is distributed to the hip joint, while a third communicates with the anterior branch of the obturator nerve. Occasionally, the accessory obturator nerve is very small and is lost in the capsule of the hip joint. When it is absent, the hip joint receives two branches from the obturator nerve. The femoral nerve, Nervus femoralis, anterior crural nerve. The largest branch of the lumbar plexus arises from the dorsal divisions of the second, third, and fourth lumbar nerves. It descends through the fibers of the psoas major, emerging from the muscle at the lower part of its lateral border, and passes down between it and the iliacus, behind the iliac fascia. It then runs beneath the inguinal ligament into the thigh, and splits into an anterior and a posterior division. Under the inguinal ligament it is separated from the femoral artery by a portion of the psoas major. Within the abdomen the femoral nerve gives off small branches to the iliacus, and a branch which is distributed upon the upper part of the femoral artery. The latter branch may arise in the thigh. In the thigh, the anterior division of the femoral nerve gives off anterior cutaneous and muscular branches. The anterior cutaneous branches comprise the intermediate and medial cutaneous nerves. The intermediate cutaneous nerve, ramus cutaneous anterior, middle cutaneous nerve, pierces the fascia lata, and generally the sartorius, about 7.5 centimeters below the inguinal ligament, and divides into two branches which descend in immediate proximity along the forepart of the thigh, to supply the skin as low as the front of the knee. Here they communicate with the medial cutaneous nerve and the infrapatellar branch of the saphenous to form the patellar plexus. In the upper part of the thigh, the lateral branch of the intermediate cutaneous communicates with the lumboinguinal branch of the genitofemoral nerve. The medial cutaneous nerve, ramus cutaneous anterior, internal cutaneous nerve, passes obliquely across the upper part of the sheath of the femoral artery and divides in front, or at the medial side of that vessel, into two branches, an anterior and a posterior. The anterior branch runs downward on the sartorius, perforates the fascia lata at the lower third of the thigh, and divides into two branches. One supplies the integument as low down as the medial side of the knee. The other crosses to the lateral side of the patella, communicating in its course with the infrapatellar branch of the saphenous nerve. The posterior branch descends along the medial border of the sartorius muscle to the knee, where it pierces the fascia lata, communicates with the saphenous nerve, and gives off several cutaneous branches. It then passes down to supply the integument of the medial side of the leg. Beneath the fascia lata, at the lower border of the adductor longus, it joins to form a plexiform network, subsartorial plexus, with branches of the saphenous and obturator nerves. When the communicating branch from the obturator nerve is large and continued to the integument of the leg, the posterior branch of the medial cutaneous is small and terminates in the plexus, occasionally giving off a few cutaneous filaments. The medial cutaneous nerve, before dividing, gives off a few filaments, which pierce the fascia lata to supply the integument of the medial side of the thigh, accompanying the long saphenous vein. One of these filaments passes through the saphenous opening. A second becomes subcutaneous about the middle of the thigh. A third pierces the fascia at its lower third. Muscular branches. Rami muscularis. The nerve to the pectineus arises immediately below the inguinal ligament, and passes behind the femoral sheath to enter the anterior surface of the muscle. It is often duplicated. The nerve to the sartorius arises in common with the intermediate cutaneous. The posterior division of the femoral nerve gives off the saphenous nerve and muscular and articular branches. The saphenous nerve. Nervus saphenous, long or internal saphenous nerve, is the largest cutaneous branch of the femoral nerve. It approaches the femoral artery where this vessel passes beneath the sartorius and lies in front of it, behind the aponeurotic covering of the adductor canal, as far as the opening in the lower part of the adductor magnus. Here it quits the artery and emerges from behind the lower edge of the aponeurotic covering of the canal. It descends vertically along the medial side of the knee behind the sartorius, pierces the fascia lata between the tendons of the sartorius and gracilis, and becomes subcutaneous. The nerve then passes along the tibial side of the leg, accompanied by the great saphenous vein, descends behind the medial border of the tibia, and, at the lower third of the leg, divides into two branches. One continues its course along the margin of the tibia and ends at the ankle. The other passes in front of the ankle, and is distributed to the skin on the medial side of the foot, as far as the ball of the great toe, communicating with the medial branch of the superficial perineal nerve. Branches. The saphenous nerve, about the middle of the thigh, gives off a branch which joins the subsartorial plexus. At the medial side of the knee it gives off a large infrapatellar branch, which pierces the sartorius and fascia lata, and is distributed to the skin in front of the patella. This nerve communicates above the knee with the anterior cutaneous branches of the femoral nerve, below the knee, with other branches of the saphenous, and, on the lateral side of the joint, with branches of the lateral femoral cutaneous nerve, forming a plexiform network, the plexus patellae. The infrapatellar branch is occasionally small, and ends by joining the anterior cutaneous branches of the femoral, which supply its place in front of the knee. Below the knee, the branches of the saphenous nerve are distributed to the skin of the front and medial side of the leg, communicating with the cutaneous branches of the femoral, or with filaments from the obturator nerve. The muscular branches supply the fore parts of the quadriceps femoris. The branch to the rectus femoris enters the upper part of the deep surface of the muscle and supplies a filament to the hip joint. The branch to the vastus lateralis, of large size, accompanies the descending branch of the lateral femoral circumflex artery to the lower part of the muscle. It gives off an articular filament to the knee joint. The branch to the vastus medialis descends lateral to the femoral vessels in company with the saphenous nerve. It enters the muscle about its middle, and gives off a filament, which can usually be traced downward on the surface of the muscle to the knee joint. The branches to the vastus intermedius, 2 or 3 in number, enter the anterior surface of the muscle about the middle of the thigh. A filament from one of these descends through the muscle to the articularis genu and the knee joint. The articular branch to the hip joint is derived from the nerve to the rectus femoris. The articular branches to the knee joint are 3 in number. 1. A long, slender filament is derived from the nerve to the vastus lateralis. It penetrates the capsule of the joint on its anterior aspect. Another, derived from the nerve to the vastus medialis, can usually be traced downward on the surface of this muscle to near the joint. It then penetrates the muscular fibers, and accompanies the articular branch of the highest genicular artery, pierces the medial side of the articular capsule, and supplies the synovial membrane. The third branch is derived from the nerve to the vastus intermedius. Footnote, Note 135. In most cases the fourth lumbar is the nervus porcalis, but this arrangement is frequently departed from. The third is occasionally the lowest nerve which enters the lumbar plexus, giving at the same time some fibers to the sacral plexus, and thus forming the nervus porcalis. Or both the third and fourth may be furcal nerves. When this occurs, the plexus is termed high or prefixed. More frequently the fifth nerve is divided between the lumbar and sacral plexuses, and constitutes the nervus porcalis, and when this takes place the plexus is distinguished as a low or postfixed plexus. These variations necessarily produce corresponding modifications in the sacral plexus. End footnote. End of section 40.
Of Anatomy of the Human Body, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body by Henry Gray, Part 4. The Sacral and Coccygeal Nerves. Nervi sacralis and coccygeus. The anterior divisions of the sacral and coccygeal nerves, rami anterioris, form the sacral and pudendal plexuses. The anterior divisions of the upper four sacral nerves enter the pelvis through the anterior sacral foramina, that of the fifth between the sacrum and coccyx, while that of the coccygeal nerve curves forward below the rudimentary transverse process of the first piece of the coccyx. The first and second sacral nerves are large. The third, fourth, and fifth diminish progressively from above downward. Each receives a gray ramus communicans from the corresponding ganglion of the sympathetic trunk, while from the third and frequently from the second and the fourth sacral nerves, a white ramus communicans is given to the pelvic plexuses of the sympathetic. The Sacral Plexus, Plexus sacralis. The sacral plexus is formed by the lumbosacral trunk, the anterior division of the first, and portions of the anterior divisions of the second and third sacral nerves. The lumbosacral trunk comprises the whole of the anterior division of the fifth and a part of that of the fourth lumbar nerve. It appears at the medial margin of the psoas major and runs downward over the pelvic brim to form the first sacral nerve. The anterior division of the third sacral nerve divides into an upper and a lower branch, the former entering the sacral and the latter the pudendal plexus. The nerves forming the sacral plexus converge toward the lower part of the greater sciatic foramen and unite to form a flattened band, from the anterior and posterior surfaces of which several branches arise. The band itself is continued as the sciatic nerve, which splits on the back of the thigh into the tibial and common perineal nerves. These two nerves sometimes arise separately from the plexus, and in all cases their independence can be shown by dissection. Relation. The sacral plexus lies on the back of the pelvis between the piriformis and the pelvic fascia. In front of it are the hypogastric vessels, the ureter, and the sigmoid colon. The superior gluteal vessels run between the lumbosacral trunk and the first sacral nerve, and the inferior gluteal vessels between the second and third sacral nerves. All the nerves entering the plexus, with the exception of the third sacral, split into ventral and dorsal divisions, and the nerves arising from these are as follows. Nerve to quadratus femoris and gemellus inferior, ventral divisions, fourth and fifth lumbar, first sacral. Nerve to obturator internus and gemellus superior, ventral divisions, fifth lumbar, first and second sacral. Nerve to piriformis, dorsal divisions, first, second sacral. Superior gluteal, dorsal divisions, fourth and fifth lumbar, first sacral. Inferior gluteal, dorsal divisions, fifth lumbar, first and second sacral. Posterior femorocutaneous, ventral divisions, second and third sacral, dorsal divisions, first and second sacral. Sciatic, tibial, ventral divisions, fourth and fifth lumbar, first, second, and third sacral. Common perineal, dorsal divisions, fourth and fifth lumbar, first and second sacral. The nerve to the quadratus femoris and gemellus inferior arises from the ventral divisions of the fourth and fifth lumbar and first sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and runs down in front of the sciatic nerve, the gemelli, and the tendon of the obturator internus, and enters the anterior surfaces of the muscles. It gives an articular branch to the hip joint. The nerve to the obturator internus and gemellus superior arises from the ventral divisions of the fifth lumbar and first and second sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and gives off the branch to the gemellus superior, which enters the upper part of the posterior surface of the muscle. It then crosses the ischial spine, re-enters the pelvis through the lesser sciatic foramen, and pierces the pelvic surface of the obturator internus. The nerve to the piriformis arises from the dorsal division of the second sacral nerve, or the dorsal divisions of the first and second sacral nerves, and enters the anterior surface of the muscle. This nerve may be double. The superior gluteal nerve, nervus gluteus superior, arises from the dorsal divisions of the fourth and fifth lumbar and first sacral nerves. It leaves the pelvis through the greater sciatic foramen above the piriformis, accompanied by the superior gluteal vessels, and divides into a superior and an inferior branch. The superior branch accompanies the upper branch of the deep division of the superior gluteal artery and ends in the gluteus minimus. The inferior branch runs with the lower branch of the deep division of the superior gluteal artery across the gluteus minimus. It gives filaments to the gluteae medius and minimus, and ends in the tensor fasciae lati. The inferior gluteal nerve, nervus gluteus inferior, arises from the dorsal divisions of the fifth lumbar and first and second sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and divides into branches which enter the deep surface of the gluteus maximus. The posterior femoral cutaneous nerve, nervus cutaneous femoralis posterior, small sciatic nerve, is distributed to the skin of the perineum and the posterior surface of the thigh and leg. It arises partly from the dorsal divisions of the first and second, and from the ventral divisions of the second and third sacral nerves, and issues from the pelvis through the greater sciatic foramen, below the piriformis. It then descends beneath the gluteus maximus with the inferior gluteal artery, and runs down the back of the thigh beneath the fascia lata, and over the long head of the biceps femoris to the back of the knee. Here it pierces the deep fascia, and accompanies the small saphenous vein to about the middle of the back of the leg, its terminal twigs communicating with the sural nerve. Its branches are all cutaneous, and are distributed to the gluteal region, the perineum, and the back of the thigh and leg. The gluteal branches, nervi cluneum inferioris, 3 or 4 in number, turn upward around the lower border of the gluteus maximus, and supply the skin covering the lower and lateral part of that muscle. The perineal branches, rami perinealis, are distributed to the skin at the upper and medial side of the thigh. One long perineal branch, inferior pudendal, long scrotal nerve, curves forward below and in front of the ischial tuberosity, pierces the fascia lata, and runs forward beneath the superficial fascia of the perineum to the skin of the scrotum in the male, and of the labium majus in the female. It communicates with the inferior hemorrhoidal and posterior scrotal nerves. The branches to the back of the thigh and leg consist of numerous filaments derived from both sides of the nerve, and distributed to the skin covering the back and medial side of the thigh, the popliteal fossa, and the upper part of the back of the leg. The sciatic, nervus ischiadicus, great sciatic nerve, supplies nearly the whole of the skin of the leg, the muscles of the back of the thigh, and those of the leg and foot. It is the largest nerve in the body, measuring 2 centimeters in breadth, and is the continuation of the flattened band of the Sacral Plexus. It passes out of the pelvis through the greater sciatic foramen, below the piriformis muscle. It descends between the greater trochanter of the femur and the tuberosity of the ischium, and along the back of the thigh to about its lower third, where it divides into two large branches, the tibial and common perineal nerves. This division may take place at any point between the sacral plexus and the lower third of the thigh. When it occurs at the plexus, the common perineal nerve usually pierces the piriformis. In the upper part of its course, the nerve rests upon the posterior surface of the ischium, the nerve to the quadratus femoris, the obturator internus and gemelli, and the quadratus femoris. It is accompanied by the posterior femoral cutaneous nerve and the inferior gluteal artery, and is covered by the gluteus maximus. Lower down it lies upon the adductor magnus and is crossed obliquely by the long head of the biceps femoris. The nerve gives off articular and muscular branches. The articular branches, rami articulares, arise from the upper part of the nerve and supply the hip joint, perforating the posterior part of its capsule. They are sometimes derived from the sacral plexus. The muscular branches, rami musculares, are distributed to the biceps femoris, semitendinosus, semimembranosus, and adductor magnus. The nerve to the short head of the biceps femoris comes from the common perineal part of the sciatic, while the other muscular branches arise from the tibial portion, as may be seen in those cases where there is a high division of the sciatic nerve. The tibial nerve, N. tibialis, internal popliteal nerve, the larger of the two terminal branches of the sciatic, arises from the anterior branches of the fourth and fifth lumbar and first, second, and third sacral nerves. It descends along the back of the thigh and through the middle of the popliteal fossa to the lower part of the popliteus muscle, where it passes with the popliteal artery beneath the arch of the soleus. It then runs along the back of the leg with the posterior tibial vessels to the interval between the medial malleolus and the heel, where it divides between the laciniate ligament into the medial and lateral plantar nerves. In the thigh it is overlapped by the hamstring muscles above, and then becomes more superficial, and lies lateral to and some distance from the popliteal vessels. Opposite the knee joint, it is in close relation with these vessels, and crosses to the medial side of the artery. In the leg it is covered in the upper part of its course by the muscles of the calf, lower down by the skin, the superficial and deep fascia. It is placed on the deep muscles, and lies at first to the medial side of the posterior tibial artery, but soon crosses that vessel and descends on its lateral side as far as the ankle. In the lower third of the leg, it runs parallel with the medial margin of the tendo calcaneus. The branches of this nerve are articular, muscular, medial sural cutaneous, medial calcaneal, medial, and lateral plantar. Articular branches, rami articulares, usually 3 in number, supply the knee joint. 2 of these accompany the superior and inferior medial genicular arteries, and a third the middle genicular artery. Just above the bifurcation of the nerve, an articular branch is given off to the ankle joint. Muscular branches, rami musculares, 4 or 5 in number, arise from the nerve as it lies between the 2 heads of the gastrocnemius muscle. They supply that muscle and the plantaris, soleus, and popliteus. The branch for the popliteus turns around the lower border and is distributed to the deep surface of the muscle. Lower down, muscular branches arise separately or by a common trunk and supply the soleus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. The branch to the last muscle accompanies the perineal artery. That to the soleus enters the deep surface of the muscle. The medial sural cutaneous nerve, nervus cutaneous suri medialis, nervus communicans tibialis, descends between the 2 heads of the gastrocnemius and about the middle of the back of the leg, pierces the deep fascia, and unites with the anastomotic ramus of the common perineal to form the sural nerve. The sural nerve, nervus suralis, short saphenous nerve, formed by the junction of the medial sural cutaneous with the perineal anastomotic branch, passes downward near the lateral margin of the tendo calcaneus, lying close to the small saphenous vein, to the interval between the lateral malleolus and the calcaneus. It runs forward below the lateral malleolus and is continued as the lateral dorsal-cutaneous nerve along the lateral side of the foot and little toe, communicating on the dorsum of the foot with the intermediate dorsal cutaneous nerve, a branch of the superficial perineal. In the leg, its branches communicate with those of the posterior femoral cutaneous. The medial calcaneal branches, rami calcaneae medialis, internal calcaneal branches, perforate the laciniate ligament and supply the skin of the heel and medial side of the sole of the foot. The medial plantar nerve, nervus plantaris medialis, internal plantar nerve, the larger of the two terminal divisions of the tibial nerve, accompanies the medial plantar artery. From its origin under the laciniate ligament, it passes under the cover of the abductor hallucis, and appearing between this muscle and the flexor digitorum brevis, gives off a proper digital plantar nerve, and finally divides opposite the bases of the metatarsal bones into three common digital plantar nerves. Branches. The branches of the medial plantar nerve are 1. Cutaneous, 2. Muscular, 3. Articular, 4. A proper digital nerve to the medial side of the great toe, and 5. 3 common digital nerves. The cutaneous branches pierce the plantar aponeurosis between the abductor hallucis and the flexor digitorum brevis, and are distributed to the skin of the sole of the foot. The muscular branches supply the abductor hallucis, the flexor digitorum brevis, the flexor hallucis brevis, and the first lumbriculus. Those for the abductor hallucis and flexor digitorum brevis arise from the trunk of the nerve near its origin and enter the deep surfaces of the muscles. The branch of the flexor hallucis brevis springs from the proper digital nerve to the medial side of the great toe, and that for the first lumbriculus from the first common digital nerve. The articular branches supply the articulations of the tarsus and metatarsus. The proper digital nerve of the great toe, nervi digitalis plantaris proprii, plantar digital branches, supplies the flexor hallucis brevis and the skin on the medial side of the great toe. The three common digital nerves, nervi digitalis plantaris communes, pass between the divisions of the plantar aponeurosis, and each splits into two proper digital nerves. Those of the first common digital nerve supply the adjacent sides of the great and second toes, those of the second the adjacent sides of the second and third toes, and those of the third the adjacent sides of the third and fourth toes. The third common digital nerve receives a communicating branch from the lateral plantar nerve. The first gives a twig to the first lumbriculus. Each proper digital nerve gives off cutaneous and articular filaments, and opposite the last phalanx sends upward a dorsal branch, which supplies the structures around the nail, the continuation of the nerve being distributed to the ball of the toe. It will be observed that these digital nerves are similar in their distribution to those of the median nerve in the hand. The lateral plantar nerve, nervus plantaris lateralis, external plantar nerve, supplies the skin of the fifth toe and lateral half of the fourth, as well as most of the deep muscles, its distribution being similar to that of the ulnar nerve in the hand. It passes obliquely forward with the lateral plantar artery to the lateral side of the foot, lying between the flexor digitorum brevis and the quadratus plantae, and in the interval between the former muscle and the abductor digiti quinti, divides into a superficial and a deep branch. Before its division it supplies the quadratus plantae and abductor digiti quinti. The superficial branch, ramus superficialis, splits into a proper and a common digital nerve. The proper digital nerve supplies the lateral side of the little toe, the flexor digiti quinti brevis, and the two interosii of the fourth intermetatarsal space. The common digital nerve communicates with the third common digital branch of the medial plantar nerve and divides into two proper digital nerves which supply the adjoining sides of the fourth and fifth toes. The deep branch, ramus profundus, muscular branch, accompanies the lateral plantar artery on the deep surface of the tendons of the flexor muscles and the adductor hallucis, and supplies all the interosii except those in the fourth metatarsal space, the second, third, and fourth lumbricules, and the adductor hallucis. End of section 41.
Of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. Sacral and Coccygeal Nerves, Part 2. The common perineal nerve, Nervus peroneus communis. External popliteal nerve, Perineal Nerve. About 1/2 the size of the tibial, is derived from the dorsal branches of the 4th and 5th lumbar and the 1st and 2nd sacral nerves. It descends obliquely along the lateral side of the popliteal fossa to the head of the fibula, close to the medial margin of the biceps femoris muscle. It lies between the tendon of the biceps femoris and lateral head of the gastrocnemius muscle, winds around the neck of the fibula between the peroneus longus and the bone, and divides between the muscle into the superficial and deep perineal nerves. Previous to its division, it gives off articular and lateral sural cutaneous nerves. The articular branches, rami articulares, are 3 in number. 2 of these accompany the superior and inferior lateral genicular arteries to the knee. The upper one occasionally arises from the trunk of the sciatic nerve. The third, recurrent, articular nerve is given off at the point of division of the common perineal nerve. It ascends with the anterior recurrent tibial artery through the tibialis anterior to the front of the knee. The lateral sural cutaneous nerve, Nervus cutaneus surae lateralis, lateral cutaneous branch, supplies the skin on the posterior and lateral surfaces of the leg. One branch, the perineal anastomonic, Nervus communicans fibularis, arises near the head of the fibula, crosses the lateral head of the gastrocnemius to the middle of the leg, and joins with the medial sural cutaneous to form the sural nerve. The perineal anastomonic is occasionally continued down as a separate branch as far as the heel. The deep perineal nerve, Nervus peroneus profundus, anterior tibial nerve, begins at the bifurcation of the common perineal nerve, between the fibula and the upper part of the peroneus longus, passes obliquely forward beneath the extensor digitorum longus to the front of the interosseous membrane, and comes into relation with the anterior tibular artery above the middle of the leg. It then descends with the artery to the front of the ankle joint, where it divides into a lateral and a medial terminal branch. It lies at first at the lateral side of the anterior tibial artery, then in front of it, and again on its lateral side at the ankle joint. In the leg, the deep perineal nerve supplies muscular branches to the tibialis anterior, extensor digitorum longus, peroneus tertius, and extensor hallucis proprius, and an articular branch to the ankle joint. The lateral terminal branch, external or tarsal branch, passes across the tarsus beneath the extensor digitorum brevis, and having become enlarged like the dorsal interosseous nerve at the wrist, supplies the extensor digitorum brevis. From the enlargement 3 minute interosseous branches are given off, which supply the tarsal joints and the metatarsal phalangeal joints of the 2nd, 3rd, and 4th toes. The first of these sends a filament to the 2nd interosseous dorsalis muscle. The medial terminal branch, internal branch, accompanies the dorsalis pedis artery along the dorsum of the foot, and, at the first interosseous space, divides into 2 dorsal digital nerves, nervi digitalis dorsalis hallucis lateralis et digiti secundi medialis, which supply the adjacent sides of the great and 2nd toes, communicating with the medial dorsal cutaneous branch of the superficial peroneal nerve. Before it divides, it gives off to the first space an interosseous branch, which supplies the metatarsio-phalangeal joint of the great toe and sends a filament to the first interosseous dorsalis muscle. The superficial perineal nerve, Nervus peroneus superficialis, Musculocutaneous Nerve, supplies the peroneus longus and brevis and the skin over the greater part of the dorsum of the foot. It passes forward between the peroneus and the extensor digitorum longus, pierces the deep fascia at the lower third of the leg, and divides into a medial and an intermediate dorsal cutaneous nerve. In its course between the muscles, the nerve gives off muscular branches to the peroneus longus and brevis, and cutaneous filaments to the integument of the lower part of the leg. The medial dorsal cutaneous nerve, Nervus cutaneus dorsalis medialis, internal dorsal cutaneous branch, passes in front of the ankle joint and divides into two dorsal digital branches, one of which supplies the medial side of the great toe, the other the adjacent side of the second and third toes. It also supplies the integument of the medial side of the foot and ankle, and communicates with the saphenous nerve and with the deep perineal nerve. The intermediate dorsal cutaneous nerve, Nervus cutaneus dorsalis intermedius, external dorsal cutaneous branch, the smaller, passes along the lateral part of the dorsum of the foot and divides into the dorsal digital branches, which supply the contiguous sides of the third and fourth, and of the fourth and fifth toes. It also supplies the skin of the lateral side of the foot and ankle, and communicates with the Sural Nerve. The branches of the superficial perineal nerve supply the skin of the dorsal surfaces of all the toes except the lateral side of the little toe, and the adjoining sides of the great and second toes, the former being supplied by the lateral dorsal cutaneous nerve from the Sural Nerve, and the latter by the medial branch of the deep perineal nerve. Frequently, some of the lateral branches of the superficial perineal are absent, and their places are then taken by branches of the Sural Nerve. The Pudendal Plexus, Plexus pudentus. The Pudendal Plexus is not sharply marked off from the Sacral Plexus, and, as a consequence, some of the branches which spring from it may arise in conjunction with those of the Sacral Plexus. It lies on the posterior wall of the pelvis, and is usually formed by branches from the anterior divisions of the second and third sacral nerves, the whole of the anterior divisions of the fourth and fifth sacral nerves, and the Coccygeal Nerve. It gives off the following branches: perforating cutaneous, second and third sacral; pudendal, second, third, and fourth sacral; visceral, third and fourth sacral; muscular, fourth sacral; anococcygeal, fourth and fifth sacral and coccygeal. The perforating cutaneous nerve, Nervus cluneum inferior medialis, usually arises from the posterior surface of the second and third sacral nerves. It pierces the lower part of the sacrotuberous ligament, and winding around the inferior border of the gluteus maximus, supplies the skin covering the medial and lower parts of that muscle. The perforating cutaneous nerve may arise from the pudendal, or it may be absent. In the latter case its place may be taken by a branch from the posterior femoral cutaneous nerve, or by a branch from the third and fourth, or fourth and fifth, sacral nerves. The pudendal nerve, Nervus pudentus internal pudic nerve, derives its fibers from the ventral branches of the second, third, and fourth sacral nerves. It passes between the piriformis and coccygeal muscles, and leaves the pelvis through the lower part of the greater sciatic foramen. It then crosses the spine of the ischium and re-enters the pelvis through the lesser sciatic foramen. It accompanies the internal pudendal vessels upward and forward along the lateral wall of the ichiorectal fossa, being contained in a sheath of the obturator fascia termed Alcock's canal, and divides into two terminal branches, viz., the Perineal Nerve and the Dorsal Nerve of the penis or clitoris. Before its division it gives off the inferior hemorrhoidal nerve. The inferior hemorrhoidal nerve, Nervus hemorrhoidalis inferior, occasionally arises directly from the Sacral Plexus. It crosses the ichiorectal fossa with the inferior hemorrhoidal vessels toward the anal canal and the lower end of the rectum, and is distributed to the sphincter ani externus and to the integument around the anus. Branches of this nerve communicate with the perineal branch of the posterior femoral cutaneous and with the posterior scrotal nerves at the forepart of the perineum. The perineal nerve, Nervus perinei, the inferior and larger of the two terminal branches of the pudendal, is situated below the internal pudendal artery. It accompanies the perineal artery and divides into posterior scrotal or labial and muscular branches. The posterior scrotal or labial branches, nervi scrotales or labiales posteriores, superficial peroneal nerves, are two in number, medial and lateral. They pierce the fascia of the urogenital diaphragm and run forward along the lateral part of the urethral triangle in company with the posterior scrotal branches of the perineal artery. They are distributed to the skin of the scrotum and communicate with the perineal branch of the posterior femoral cutaneous nerve. These nerves supply the labium majus in the female. The muscular branches are distributed to the transversus perineae superficialis, bulbocavernous, ichiocavernosus, and the constrictor urethra. A branch, the nerve to the bulb, given off from the nerve to the bulbocavernosus, pierces this muscle and supplies the corpus cavernosum urethrae, ending in the mucous membrane of the urethra. The dorsal nerve of the penis, Nervus dorsalis penis, is the deepest division of the pudendal nerve. It accompanies the internal pudendal artery along the ramus of the ischium. It then runs forward along the margin of the inferior ramus of the pubis, between the superior and inferior layers of the fascia of the urogenital diaphragm. Piercing the inferior layer, it gives a branch to the corpus cavernosum penis, and passes forward in company with the dorsal artery of the penis, between the layers of the suspensory ligament, onto the dorsum of the penis, and ends on the glans penis. In the female this nerve is very small, and supplies the clitoris, Nervus dorsalis clitoridis. The visceral branches arise from the third and fourth, and sometimes from the second sacral nerves, and are distributed to the bladder and rectum, and, in the female, to the vagina. They communicate with the pelvic plexuses of the sympathetic. The muscular branches are derived from the fourth sacral and supply the levator ani, coccygeus, and sphincter ani externus. The branches of the levator ani and coccygeus enter their pelvic surfaces. That to the sphincter ani externus, perineal branch, reaches the ischiorectal fossa by piercing the coccygeus or by passing between it and the levator ani. Cutaneous filaments from this branch supply the skin between the anus and the coccage. Anococcygeal nerves, nervi anococcygeae. The fifth sacral nerve receives a communicating filament from the fourth, and unites with the coccygeal nerve to form the coccygeal plexus. From this plexus the anococcygeal nerves take origin. They consist of a few fine filaments which pierce the sacrotuberous ligament to supply the skin in the region of the coccyx. Recording by David Lawrence in Brampton, Ontario, December 2009.